a problem with this. There's some websites that I would go to that have a free test for you, and it's just a pretty short questionnaire. So I would go first to sexhelp.com
Okay.
is one place. Sash.net is another place. And they have links to, I think they just even ask the question, am I a sex addict? You can click on that link and it asks you several questions, and then it tells you you might have a problem with this. So that's the first thing to do
And
is
for
it
those of
kind of,
you who are, I'm sorry to interrupt you, Dan. For those
no, it's
of you who
fine.
are watching, I will have these websites posted so that you can have access to them. I'm sorry, go
Yeah.
ahead, Dan.
No, that's great. But those two websites, and go to sash.net. They have not only links for this self-test, but they also have links for books, for resources. And there are a lot of books that you can get pretty cheap. The first one I'd really recommend if you're thinking, okay, I'm not sure if I have a problem or maybe my partner has a problem with this. One of the main first books that I'd really recommend is Out of the Shadows, and that's by Patrick Carnes. It's one of the first books written on the topic,
Okay.
and it still holds true for many people today. So that's a good book to start with. There's a workbook that you can do. I recommend using it with the help of a therapist, but you can start going through that workbook in addition to just reading about Out of the Shadows, and it's called Facing the Shadow. So it's kind of to start this process. And again, those are pretty inexpensive resources if you don't have the finances. I would recommend there are some inpatient, so there's hospitalization that can really be helpful. Just like any other chemical, you need some detox and some time to get away from these behaviors. So going to a hospital or a residential setting can really be helpful for many people. And there's some good programs. There's one in Los Angeles that they have, Del Amo Hospital. There's also some other treatment centers, Promises in LA, and then there's all over the country that there's different resources. But I would look if you're looking into something like that to make sure that they have a specified sex addiction program and they're not just dealing with chemical dependency. There's some similarities, but you want to have someone that really specializes in this area. So that's a 30 to 45 day program, which again is going to have some costs associated with it.
Right.
But there's also at the institute where I work at in Beverly Hills, we do intensive outpatient programs. So they're more affordable. It's like a 12 to 15 day option. So, and that would be kind of a 9 to 5. You come here and we'd work through some of the basics and help get some tools and get some solidity and
And I
help
think it's
move
really
forward.
it's really important that people really think about the investment in themselves, because the sex addiction really can destroy not only relationships, but there's a lot of cost to it as far as what you're going to be losing. So
Right.
again, some of the outpatient and inpatient treatment that you're suggesting at this point, it's pretty much invaluable.
Yeah, yeah, I agree. And the reality is, if it's such a huge investment, and most people can find the funds, you can find a way to make it work, but some people just can't. And if they can't, there's also going into, there's a lot of individuals that can help, and depending on what area. In Los Angeles, there's a lot of people that are certified sex addiction therapists, like we talked about, and on I believe if you look on sexhelp.com, there's a link to find CSAT therapists in whatever area that you might be looking into, and they can help you find other whatever supports are available.
Right.
Um, so they would work with you on a once a week basis and individually, or could work with you, and really for sex addiction, because of how it deals with sex and intimacy and relationships, being in a psychotherapy group is really recommended. That's one of that is the treatment of choice for sex addiction.
You mean
So
so being in a group, and I think you mentioned, or you mentioned to me that there's a lot of support groups, free resources available out there.
yes.
Okay.
Right. Now, I'm just giving a bunch of different options. It doesn't mean you have to. Those are the options available. In a perfect world, you could go to it in a residential setting, then go to an intensive outpatient and do all this, and for sure. But some people. But really, making a phone call and talking to someone, and getting to, before just diving into a full 30-day program or something, you want to meet with someone and get they can help you with different tools. and see if this is an issue for you. But yeah, there are, in addition, there's a lot of 12-step support groups that are free, and they're peer groups of people going through the same thing, and they're fantastic. One particular program, at least in Los Angeles, that I refer a lot to is Sex Addicts Anonymous,
Okay.
and that their website is saarecovery.org.
Okay.
I believe that's what it is, and they have lists of meetings in any area in the country, as well as phone meetings and online meetings they have too. So there's a bunch of different, we'll call them S programs that are sexually based. I mean, there's SAA, there's SA, there's SLAA, SCA, SRA. So there's a lot of different, and I heard of just a new one for just women that are love addicts.
Wow. Okay.
That's just being started. There's a lot of different recovery options available. Each one will have books, and you can get a sponsor and have some help through people that also are going through the same thing, and get some support and not be so isolated and stuck in shame or your own, process with this.
Right, definitely. So, like I said earlier, I will have all these websites up for people to go through and see what would work well
Okay.
for them. Now, Dan, how would one get a hold of you if they wanted to schedule an appointment? And Dan is also he has his own private practice. He's working on it, and so you can also contact him if you wanted to schedule an appointment.
Sure.
So Dan, what's your contact information?
So my phone number is 310-415-5732. That's an easy way to get a hold of me. I'm always available via email as well at dandrakemft@gmail.com. So those are available. I can't help also, Ernesto. There's one thing I do want to say is
Okay.
there's a lot of focus that we talk about with someone who's in recovery or a sex addict or someone who thinks they're a sex addict, but I also don't want to neglect the needs of a partner or family. And
Absolutely.
it's so important. Now I know that can also be more resources, but this can be so difficult for partners to go through, and I don't think there's a whole lot of people that really get it and see how traumatic this can be, and such a betrayal and such a loss of what you thought you had in a relationship. So there's such a need for getting good support for partners, as well as the families. And unfortunately, so far most of the resources have been devoted to addicts, which is great. I mean, I think there's such a need, but at least at our Beverly Hills clinic, we really try to work with partners and give them supports and resources that they need. So I'm happy. There's some books for partners. A book I would really recommend would be Mending a Shattered Heart, and that's edited by Stephanie Carnes. And start there. There's some not as many, but there's some really good books for partners. So I also just want to say that I just
Definitely. And
feel strongly about that.
yeah, and you're absolutely right. We did talk a lot about the person that's struggling with addiction, but it's not just the individual that's struggling with. It's the
Yeah.
whole family unit. It's the
Yeah.
partners. It's the married
Kids.
couple,
Yeah.
kids. And it really, it affects everybody. And so I really appreciate you saying that. There's a lot of help not only for the person that's struggling with addiction, but also for the family member or the
Yeah,
partner.
and that all too often can be neglected, and that's just not right. It's not right to have partners be neglected in this.
Yeah.
So.
Definitely. Well, Dan, you're doing a lot of good work. Come a long way from college days, huh?
That's right. Well, it's
Yeah.
I'm passionate about bringing people health, and this is one way to do it. And so
That's
yeah,
great.
it's great.
Well, Dan, thank you. For everybody out there, I will have all this information up for you. If you have any questions, give Dan a call or give me a call. Again, my name is Ernesto, marriage and family therapist, and next time I will have Dan on again to discuss some other things. But for now, thank you for listening, and we look forward to hearing from you soon. Thank you.
Thanks, Ernesto.
Okay.